My name is Dr Jodie Grigg and I'm a Research Associate at the National Drug Research Institute here at Curtin University. So I work in the Harm Reduction Policy and Strategies program. So I suppose my main field of expertise could best be described as party drugs, so particularly MDMA use and harm reduction. So to give a little more context to that, my PhD research investigated drug use, drug policy and harm reduction at music festivals. So the ultimate aim of the research was to help make events safer by contributing to more evidence-informed responses. So one of my main roles currently at ENDRI is to coordinate the West Australian arm of the Ecstasy and Related Drugs Reporting System, also called the EDRS, and it was formerly called the Party Drugs Initiative, and this is part of the wider National Drug Trends program. So I've been involved with that project since about 2010, but it's actually been running since 2003. So the Ecstasy and Related Drugs Reporting System was formed in 2003 to act as an early warning system to identify emerging drugs of concern that warrant further investigation. So every year we interview about 800 young people from around Australia, from all states and territories. So the things we monitor include market trends, so monitoring the price, purity and availability of ecstasy and related drugs, as well as patterns of use and harms. So the main drugs we focus on in that project are drugs routinely used in the context of entertainment settings. So drugs like ecstasy, MDMA, cocaine, ketamine, GHB. Also pharmaceuticals like dexamphetamines. So every year our national coordinators, the National Drug and Alcohol Research Centre, disseminate a variety of different outputs, whether that be special bulletins, infographics or summary reports. And those results are intended to help inform harm reduction initiatives and also assist clinicians, law enforcement and policymakers. I think the most interesting findings to come out of the 2021 EDRS data would be around shifts in ecstasy or MDMA consumption and market trends. So what we found in 2021 there were significant declines in the perceived purity and availability of crystal and capsule forms of MDMA. There were also declines in the percentage reporting recent use and those declines in the frequency of use. Meanwhile, there were also significant increases in the price of all forms of MDMA, which was interesting because price has been steadily declining for several years now. The other thing that was interesting, so alongside those declines in MDMA use and MDMA market trends, we were finding increases in the use of psychedelic drugs like magic mushrooms, DMT and LSD. Also certain pharmaceutical drugs like dexamphetamines and Ritalin. So these findings combined were interesting because it may be signalling some disruptions to the illicit drug market associated with the COVID-19 pandemic. So across the world, concerns have been echoed about potentially increasing risk related to MDMA use. And this is because those disruptions might be leading people or suppliers and manufacturers to sell riskier stimulants as MDMA. So in the 2000s, there was a crackdown on the precursor chemical saffrol, which is used in the production of MDMA. So those crackdowns led to a global ecstasy shortage in the late 2000s. So in our EDRS survey, by 2011, we were finding it very difficult to recruit anybody that used ecstasy, and that was because of a lack of availability, but also what was circulating was such poor quality. So what we think happened was there was a growing disenchantment. So in terms of why this shift occurred, people, there was this growing disenchantment with the MDMA market and those really low purity ecstasy tablets. So essentially, illicit drug manufacturers and suppliers kind of rebranded ecstasy and brought in these new premium products, so MDMA crystals and capsules. So back in about 2010, when there was the big global ecstasy drought, there was this flooding of new psychoactive substances, so hundreds every week were being discovered. And you might remember there was a lot of drugs being sold as ecstasy that were actually piperazines, so like BZP, which were notoriously bad in terms of side effects. So that kind of dwindled away with the resurgence of ecstasy, and new psychoactive substances have become less common once those traditional drugs like MDMA are back on the market. But the other risks that are coming through more recently are other cathinones and also drugs like NBOMe and 2CB that are being misrepresented as ecstasy. And I guess the problem with these newer drugs is we don't know a lot about the effects, short-term or long-term, and people are expecting MDMA effects, and when they start experiencing more psychedelic effects, that can be very scary for them. And also going back to PMA, which has been historically misrepresented as ecstasy and is a very dangerous drug. I think it got the nickname something death. It's a very dangerous drug, but the risk with that is it has a slower onset of effects. So that leads to people redosing, thinking that the MDMA hasn't hit yet. So you might redose after taking MDMA in 40 minutes to 60 minutes. But the effects of the PMA might not hit for up to 2 hours. So you're essentially doubling up on the PMA, and then it's all hits them at once, and that's led to quite a few deaths around the world. So it's been very interesting over my career to watch this shift in the narrative. I think it has been mainly positive. So we are seeing shifts in public perception around greater acceptability of trialling things like drug checking and even considering decriminalisation. So the reasons for this, I think, are, in terms of festivals, since about 2014, every festival season there seems to be an increasing number of drug-related deaths. So there's been kind of an unprecedented level of media attention. And while some of this is sensationalized to make drugs seem like this obviously terrible problem, I think what's happened is there's been a lot of really great harm reduction advocates who have really effectively engaged with the media to get the evidence out there. And I think that's helped shift public perception, and people, I think, are starting to have a more open mind. I do think pill testing at drug festivals would be an effective strategy when used in a broader suite of harm reduction measures. So one of the, I suppose, arguments that continuously gets put forth by certain politicians and journalists is that, the evidence isn't there and it's not feasible at festivals. But we know that simply isn't the case. Drug checking has been operating at festivals in countries around the world for up to 50 years. It's operating now, and there are countries that are using very high-grade laboratory equipment to effectively test both quantity, content and quantity of dose at festivals. So we know it absolutely is feasible. And the evidence is continuously growing around the world. I mean, within Australia, we know in the ACT there's been 2 successful trials, and the ACT government has actually just committed to funding a fixed site trial. New Zealand has also just, I think, legalised drug checking. So, I mean, the evidence base is growing around the world, and we know that it's not just about checking the drugs. These services provide an opportunity for young people to engage with health experts who wouldn't otherwise, because normally the ecstasy just doesn't get to the point of being problematic. But they get to engage with health experts about harm reduction strategies, so they learn about things like hypothermia when using MDMA, the water intake guidelines to reduce risks of things like water intoxication or hyponatremia. So that brief intervention or educational component is just as important as testing the actual pills. And of course, testing the actual pills leads to friends, sort of this like spreading of information, which can kind of create a quality control within an illicit drug market. Yeah, that's a really good question, because it's been thrown into the drug policy debate quite a bit lately, with politicians like the New South Wales Premier making the argument that drug checking won't help because people are dying from high purity MDMA, not from adulterated substances. So that has been the case in the kind of the most recent spate of overdoses. As I mentioned before, there's been this shift towards these really high purity MDMA capsules and tablets. So that definitely has resurfaced as a concern. It hasn't historically been the main concern. Historically, the problem has been adulteration. So substances like PMA or new psychoactive substances being misrepresented as ecstasy. So pre-pandemic, I would have said the main concern was high purity MDMA leading to actual overdoses. But post-pandemic, I think we need to be concerned equally about high purity substances and unpredictable substances with the illicit drug market disruption. So I think we now have, I mean, it's hard to tell what kind of the risk will be for each of those, but I guess we'll find out moving forward. But yeah, as I said, historically the problem has been more about adulteration. Moving forward now, it's both are an equal concern. And yeah, that's reflected in the coroner's reports for deaths as well, I think. In my personal opinion, I do think we are heading in that direction. I do think inevitably they will be decriminalised or legalised. What that model will look like, I don't know. What do I think it should look like? Again, I think we need to draw on the evidence of different models around the world. You've got Portugal's decriminalisation model. Obviously, a legal regulated market would help eliminate some of those issues around adulterated substances, crime, and I guess barriers to people seeking help. So if we want to reduce those harms that come out of the black market, then I would say it's worth looking at a legal regulated market. But yeah, I do think in some time it definitely could occur.